look for allergic reactions, you know, like we said, with any product. Also with polysporin, they may get a dermatitis, little bumps that are occurring. Other allergic reactions to products could be the skin will react, and you can start seeing a red occurrence. Again, there could be an infection versus a reaction, and that's where you're going to want to distinguish. If you don't know, always get the doctor involved, because it's better to be safe than sorry. But primarily, you just remove the agent that's causing it. So if you're using polysporin, you stop it. If you're using a gel, stop it. Sometimes people will use a gel and then the individual may put like on a barrier or a film or even a scar remodeling type of pressure garment, and it can cause too much little beads of sweat and get a dermatitis or some form of a rash underneath your dressings or whatever. So again, that's stuff you want to educate and you're looking at. This is a wound that was a surgical wound that went awry, and there was development of an infection and the wound dehisced. The Mepitel with wound gel is the non-adhering dressing that I'm putting actually over the wound first. And then I am applying my gel. Now you can do it the other way if you want. You can put the gel down and then this. It doesn't really matter. But this is a non-adhering. The Reveals also has some silicone in it, so that's going to be a non-stick. I personally don't use Adaptic anymore. I haven't for years, but that is a choice that is out there. The Mepitel, as you can see, it's porous. It does have holes in it like a mesh, and therefore your product will work right through it. You can even put your foams on it, your absorbents on it, your alginates on it, right on the Mepitel that's over the wound. Now as we start to transition into our moist wound products, this is pretty much where we're going for the rest of this course. So a lot of times the therapists will ask, what do you want in your clinic? What are the mainstays? So again, as I said, you want a gel, which is critical, your non-adherent dressing, some form of a spray, and then you're probably going to have some form of absorbent, some form of an alginate, and then some ointments that we'll get into.